Welcome to Your Health, Your Knowledge, Your Power. This is the channel where we are learning the facts while exploring current health related topics. And so, this session, we're going to cover protection from COVID this fall and winter season. And so, when looking at protecting yourself from contracting COVID, which then can increase and lead to long term COVID, we want to take a look at some of the past patterns. And so, identifying these patterns are really important. It is a key when we're looking at how to protect ourselves from COVID. And so, you can see from the last few years, we end up having 2023. January 7th, we can see that there was a peak, and this is identifying the number of deaths that have occurred due to COVID. So we see that there's an increase, and then there's that peak. For 2024, we can also see, again, we can see that tallest peak was January 13th of 2024. And for the year of 2025, we can see there is a peak here, and that peak, again, January 11th. 2025. And so when looking to protecting yourselves from COVID, it's important especially to look at these patterns and then focus in on the months of December and January especially, because we can see the incidence of cases increasing and we end up having those peaks. And so to take those precautions, you want to make sure that you're washing your hands thoroughly, wearing a mask, especially in areas where you know that the transmission risk can be increased, and then using disinfectants to clean down areas. Now, does the COVID vaccine prevent COVID? And what would the answer be there? The answer is no. The COVID vaccine does not prevent COVID. And so does the vaccine cut your risk of getting long COVID? And so long COVID would be described as having symptoms after 3 months from when the individual contracted the active infection. So does COVID vaccine cut your risk of getting long COVID? And the answer is no. It does not prevent an individual. It does not reduce the risk of getting long COVID. And so research says yes, but that was back in 2021. We are now here in 2025, entering into the month of November. And so what does this mean, and why is this the case? Well, research and studies have been conducted, and we can see that in Yale University, they have found that many individuals that have actually taken the vaccine, not only does it not prevent COVID, not only does it not prevent a person from having long COVID symptoms, but something really surprising is starting to identify patterns. They're seeing that for the majority of the people who are taking these vaccines, they are not having any issues. But for a significant number of individuals, that they are experiencing symptoms such as extreme fatigue, brain fog, dizziness, and insomnia, which can last for months, and then for some people can last for years. So this is shattering. And so is this something new? It isn't something new. If we take a look down at the bottom here where it says post-COVID vaccination syndrome, that was July of 2023. And so this was a study, and it's identifying that people are having adverse symptoms to simply just the vaccine. It's not that they ended up contracting COVID. They just got the vaccine. If we look at May of 2024, post-COVID conditions following the COVID-19 vaccination, again, there is an alert coming out saying this is something that we need to look at. Here we see February 19th, 2025, a deeper understanding of this post-vaccination syndrome. It needs to be looked into. Why? Because this is starting to show patterns. And so if we take a look with the National Institutes of Health, they've come out with information. The post-acute COVID-19 vaccination syndrome, it is not officially recognized as a disease. So that ends up hampering the treatment and therapies that those individuals who end up contracting these symptoms and it becomes a syndrome, that they're not able to get the assistance that is needed. When we take a look at India, India has put out research, and they have said that after the vaccines that they have used, which are not Moderna or Pfizer, they're using other vaccines, but still they're charting to see the adverse effects of symptoms after a person has gotten a vaccine. This is not dealing with people contracting actual COVID, it is the vaccine. And so after individuals ended up getting the vaccine, 52.8% of them, after 1 month, they had at least one post-vaccine symptom. And for those individuals who ended up getting a booster, the booster ended up showing that 83.9% of those individuals who got the booster, they showed at least one post-vaccine symptom. This is really interesting and something that we really have to look at, and many individuals and researchers and scientists are looking at this. And so the Independent Medical Alliance, they are saying, listen, we've done our own research, we've seen our own patients, we're looking at the research of others, especially Yale University, and consistently we are pointing towards the same conclusion, that this post-vaccine syndrome, it is not exceedingly rare. It is not psychological, and mainstream institutions are not adequately addressing it. And so if we take a look on this slide here, you can see the post-vaccine syndrome, you see the post-COVID syndrome. And these symptoms that are listed, they are identical. Excessive fatigue, exercise intolerance, brain fog, insomnia, and dizziness. And so as we take a look at this, is anybody listening? Well, apparently someone is listening, and that is Moderna. So Moderna has come out with a new lower dose COVID-19 vaccine. It was approved in June of this year. The FDA approved it, and so they've rolled it out for this fall. And so this new lower dose vaccine, it is actually 1/5 of the dosage of the current vaccine. It is approved for those who are 65 years and older. It is also approved for those who are 12 to 64-year-olds with at least one underlying condition that puts them at a higher risk for severe outcomes. And so when taking a look how to protect yourself from COVID this fall and this winter season, it is especially important for those individuals who already are diagnosed with long COVID, that they identify their support group. It is important to take the precautions to prevent COVID by washing your hands, wearing a mask, using disinfectants to prevent from contracting COVID, and then progressing to long COVID. And then stay informed on the most current vaccines, the medications, and the preventive measures. And there is strength and unity to prevent transmission. And remember your respiratory etiquette. If someone is coughing or sneezing, it is important to contain those secretions. Contain the cough into the elbow region, cough into the clothing, sneeze, contain those aerosolized droplets, sneeze into the elbow region, sneeze into clothing if needed. And so I share with you, wherever you may find yourself, you can always improve your health. Stay healthy and well. I am Dra.Maloof, and just sharing knowledge to empower you. If you'd like to subscribe, please do. I welcome your subscriptions and comments. Until the next time, take care.